All right, so this stretch is in the thoracic region, and it's going to be a little bit of a thoracic stretch as well as targeting the rhomboids and rear delts here. Okay, so the client's going to be supine face up. You're going to take them by their wrist, switch hands, and this hand will kind of hold their hand from underneath on the outside of their thumb, and then you'll take your other hand and grab their scapula. I'll show you on the other angle so you can kind of see what I mean. And then from there, you'll slowly rotate and pull them at their wrist. Don't pull them at their hands, so that way the way the pressure doesn't happen at their joint. Kind of pull at the top of their wrist joint, so that way you're when you apply that pressure, and it doesn't cause them any pain or discomfort. Then you'll pull them to where they're almost parallel, pulling from your fingers underneath their scapula. Okay, how's that feel there? Okay, and then to go a little bit deeper into the stretch, as well as you can have their hand underneath their head for comfort. And then to go a little bit deeper into the stretch, you apply your hand on top of their elbow and kind of push down while continuing to rotate. Okay, that's going to get a little bit more of a rear delt in there, as well as getting the rhomboid and thoracic rotation happening here. This one, the only thing you need to really be careful of is how much pressure and torque you're applying on the shoulder. So once you move into pushing downward, it's going to happen to be a more rear delt stretch on that one. So basically, make sure you communicate with the customer and ask them how it's feeling, if they can go a little bit deeper. So let me show you on this side. So you'll start by taking the client. You can have this client's hand supporting their head, and then from there you will take the client's hand. Now this is kind of the key, is where you're holding them. So you're not just pulling from the shoulder. Try and find their scapula, which is the bone here behind there. Try and get your hands underneath that, so that when you're pulling, you're kind of stretching their rhomboid, and then push down on their shoulder here to apply the additional rotation, as well as kind of engage their rhomboids, which helps enhance the stretch and get a little bit greater intensity to it. Okay, and that's going to target the rhomboids as well as the rear delt. The range of motion on this one's very small. Depending on who you're working on, thick clients may not feel this one unless you're using a lot of force and pressure. So that might be kind of a problem that you will encounter. Is the thicker and more muscular the client is, the harder this one's going to be to accomplish without a lot of force or a lot of traction involved. If they're kind of thinner, then it's a little bit easier to implement this stretch. So kind of depending on who you're working on, they may or may not feel it as greatly. That's kind of one thing you have to be aware of. And then just coaching them to relax on this one, and make sure you use a lot of force on the rhomboid, but be careful of the client's shoulder and communicate with them to make sure you're not putting too much pressure on their posterior deltoid, and it is not causing any discomfort in their shoulder during this stretch. The other variation that you could apply on this one, this is one that you might have to use on someone who's a little bit more muscular, is you could also kind of pull downward, okay, depending on the client, and see how they feel. So instead of just pulling straight across, you could pull a little bit of a downward angle with their arm, as well as at an upward angle, okay. Now, depending on now we use those only on more muscular clients, and then they will get a little bit more into the lats as well. Okay, so I'll just show you this on the other side. Otherwise, for the most clients, until you have some practice, I would start off with just doing a rotational stretch across the body. Okay, now the upward angle looks like this. Okay, and the downward angle looks a little bit more like this. Okay, but I would start off with the just the straight across variation. That's the one you'll have the most success on, and pressing down on their elbow, because most clients will feel that a little bit quicker, especially if they're not muscular. So if they're really muscular and they're not feeling it, play around with the different variations of this one. Otherwise, for most clients, going straight across will be most effective for them.